So I would like to welcome you all to this IMI Conception webinar. Today we will launch our toolkit, which is a guide to help you with the planning and developing of communications campaigns to stimulate reporting of medicines use in pregnancy and during breastfeeding. We have a whole team of presenters today. My name is Marjolein Willemen. I work for Novartis Pharma, and as part of my work, I'm also involved in IMI Conception. We will also have a presentation from Josephine, who is from Uppsala University and is our communications expert. She will present today on digital campaigning. And our toolkit is based on the experience of campaigning in 2 pilot studies, one in the Netherlands and one in the UK. And I'm very happy that Agnes and Sally will present to us an overview of their campaigns and what their main learnings and take-home messages were. We will save all the questions to the end of this session and first go through all the presentations one after the other. So I would like to start now with a very brief overview of the IMI Conception project. It's a public-private partnership which is funded by the EU and led by Novartis together with University Medical Center in Utrecht. It started 4 years ago in 2019 and will conclude next year, 2024. It's a huge project. There are almost 90 organizations included, which includes, for example, the EMA, many pharmaceutical companies, academia, but also public health organizations, teratology networks, and pharmacovigilance centers. The overall mission of this project is to build a broad ecosystem to generate robust scientific evidence on the safety and efficacy of medicine use in pregnancy and during breastfeeding. And to go into a little more detail here, I would like to go to this slide, because really, why would we need such a project like ConcePTION? Are those data not available for medicines that are on the market? And unfortunately, the answer is no. I think everybody will agree that every woman has the right to use safe and effective medicines when she's pregnant, because she's not only responsible in taking decisions for herself, but also for her unborn or newborn baby. And this is further illustrated in the picture below on this slide. If it shows you how a development process looks like. So it starts with animal studies. If you are going to develop a molecule into a medicine, and those animal studies are giving a lot of very useful information and data, but this is not always 100% predictable for the effects in human. So therefore, this is the next phase. It's clinical development, phase 1, 2, and 3 research. And often here the case is, also here, pregnant women are not included in the clinical studies that are done in this part of clinical development. And this means actually that at the point of registration, a medicine gets approved. There's usually only very limited information available on safety and efficacy of that specific medicine in pregnant and breastfeeding women. And this clearly shows that there is this very important phase after registration when a drug is used in real life in clinical practice, so outside the highly controlled clinical trial setting, where we can generate a lot of data on the effects of medicines in groups that have not been part of the clinical development process, like pregnant and breastfeeding women. Sorry. So this whole process of collecting spontaneous reports of medicines that are used in real life is what we call pharmacovigilance. And there are different groups and organizations like teratology information centers, health authority, national pharmacovigilance centers that collect and monitor these reports, regardless of the outcome, and use those data to generate further evidence on the safety and efficacy of medicines. And this is also exactly the point where our toolkit comes into the game. Because with our toolkit, we want to provide a hands-on, pragmatic, and very easy to use guide to help this center, health authorities, or any other interested party to plan and run a communication campaign. To raise awareness on medicine use in pregnancy and lactation, or to stimulate reporting of use in pregnancy and during breastfeeding, but also it could be used, your campaign could aim to stimulate participating in your studies or registries. And what we did is that all the, and because we know that there are very large differences between countries on how pharmacovigilance is organized, all the examples that we include in our toolkit are adaptable to your own local situation. And this now gets me to the toolkit itself. As I just said, it includes a step-by-step guide and a plan on how to run a campaign, and it makes it possible to tailor your messages for any digital or print communications and social media campaigns. And all the examples of the materials that we have included in the toolkit are adaptable in an easy way. So we use PowerPoint and we use Word format. So it's not necessary to use any fancy professional programs or something like that. And before going into more detail here, I think it's important also to briefly mention how we came to this toolkit. So as part of ConcePTION, there were 2 pilot campaigns that were run, one in the Netherlands and one in the UK, as I said before, and both campaigns aim to increase the awareness and the participation in their local pregnancy registers. All the communications, so the idea of the campaigns was similar, but I must admit that the setup, the design, and the budget of the 2 campaigns were very different. However, it was very important that both campaigns used messages and communication strategies that were specifically tailored at their specific target audiences. And the materials that are part of the toolkit today have been tested and used in these campaigns. So we were really able to take their feedback and input into account when we were developing the toolkits. And we feel that this is very important testing phase of the toolkit actually in that regard. And in the second half of our webinar today, we will also learn more on these 2 pilot campaigns. So now let's go to the toolkit itself. The setup is quite simple. There are 8 steps and 4 tools. We start with the steps. It may seem to be a lot, but believe me, it's really doable for someone without a background in communications like me to go through it and to get it up and running. So the whole campaign is cut into these 8 steps, which together will provide you with a structure and a framework that you will need when you're planning a campaign. Some steps may seem to be obvious, but when you go through all the steps one by one, you end up with the structured plan that you will need if you are going to run a campaign. I would like to go to step 1 now. So the objective of a campaign, again, may seem to be obvious, but you really need a very simple, clear and concise objective to describe what you want to achieve and how you want to achieve that in your campaign. For example, do you aim to increase the number of hits on your website? Or do you want to increase the number of reports of medicines used in your database? And that is what you really need to think through if you go through this first step. And then next, as soon as you have decided on your objective, you need to identify your target audience. Maybe very different from country to country, depends on how your healthcare system is organized, but it also depends on how your pharmacovigilance system is organized. If you're aiming to reach pregnant women, where are they? Where do they go for their regular checkups? Do they go to a specialist or do they go to a midwife like in the Netherlands? And these are the examples that you need to consider when you are identifying your target audience. And this is also very closely related then to the third step, because that will define which communication channels you are planning to use. Because maybe in your country there is this one famous website that every pregnant woman goes to collect information on a pregnancy. Or maybe are print materials more suitable for you and if you want to reach women that are in the waiting room for their regular checkups. So you will need to find out which communication channel gives you the highest chance of success, the highest reach of your target audience. And I'm going to skip a few steps now because Josephine will address part of it also in her part. like the key messages and the digital campaigning. So I jump now to step 8. And because I think step 8 is also a very important one. If you are running or planning to run a campaign, it will take you a lot of time and dedication and work to get it up and running. And I think it's very important that in the end of the day, that you are able also to measure the impact of the campaign that you have spent so much time on. And here also, there are different ways of measuring the results of your campaign. You can check how many views did you get on a Twitter post, or how many websites clicks. That are the campaign activities as such. But also there are other options, like how well did people understand our messages? Or more on an outcome side is, did we see indeed an increase in the number of reports, or did we see an increase in the number of participants in our study? And all these examples of measuring outcomes are also coming together in your campaign planning. And you may think that it may be difficult or require IT, a lot of IT work on getting this up and running, but also here the toolkit is really aiming to provide an easy, pragmatic way of measuring the outcomes of your campaign in that regard. Because I think it's really important to show that your work is paying off in the end of the day. So these are the 8 steps. And as I said in the beginning, there are also the 4 tools. The 4 tools are actually examples of materials that we have made available in the adaptable formats. There are, for example, infographics for social media in a PowerPoint format, or print materials that you can translate into local languages. And there are also nice examples of how to use hashtags in Twitter messages. And the slides here gives you a flavor of the materials, how they look like. And I really want to invite you to take a look at the toolkit. On this address, on this website, we have posted everything together. We will share it also after the meeting. And this is where I would like to go to Josephine's part. She will talk to, she's not able to be here today, so she recorded her presentation where she will present on digital campaigning and key messages from a communications perspective.